Oh my goodness, what a difference a couple of days make.
Professor Noel Fitzpatrick
All right, Mrs. Cuddle Monster incoming.
is the Supervet.
We have issues.
I knew I should have got chihuahuas.
At his unique vet practice, he merges mechanics and biology.
Past the point of no return now. Don't be pulling apart my repair, missus.
To heal the nation's pets.
Sorry about coronavirus.
Oh, because you're responsible?
I'm responsible for almost everything else.
Even in the darkest days,
I'm so sorry this has happened to you.
Noel imagines the impossible.
Oh, my little baby girl's leg.
Let's go. Sometimes you have to bend the rules of mechanics to fit the biology.
And offers hope.
We've definitely made the right decision. Good boy. We've got my boy back.
For families and their friends.
Look at you! Bionic doggo!
Yes, mate, I love you too.
I need a nurse or vet, please.
Emergency cases that have been referred to Fitzpatrick referrals
She's taking him.
are often challenging, as well as unpredictable.
When an accident happens, it can take time for us to understand the true extension of the trauma.
We get a circuit.
So there's definitely some very obvious and clear to the eye,
Laryngoscope.
but there are others that, depending on how ill they are when they arrive, that might remain hidden until we actually get to the bottom of it.
We've got a femoral, Can you feel? Yeah, okay, it's fine, it's fine. We're breathing.
Hey, gorgeous man. It must have been a pretty horrendous last few weeks. Hopefully, this is the beginning of turning the corner.
4 weeks ago, Angus, a 5-year-old Golden Doodle, went through a terrifying ordeal and sustained life-changing injuries.
We've come because Angus fell off a cliff in the Forest of Dean. He's definitely got some big problems, and he can't carry on as he is because he's in lots of pain and he can't really go anywhere. So we're hoping to show him some kindness by bringing him here and see what we can do for him.
Zoe lives in Northamptonshire with her 4 children. 13-year-old Coco,
It'd be nice. No, Coco, thank you, no. There we go.
11-year-old Bertie,
Super careful on the steps, Cokes, okay?
8-year-old Purdy, and 10-year-old Serafina. Plus a menagerie of other animals, including Hamish the Spaniel.
I think we currently have 3 ducks and 4 ducklings, 3 hens and 4 baby hens and a cockerel. Go! Most of our leisure and lives revolve around the animals, and we are very outdoorsy. Come on, Roots.
From the moment Angus arrived, Zoe knew he was the ideal dog for her boisterous brood.
Angus, he has the most amazing character. If anyone's a bit down, he knows. He's always the first one to turn up with a big, heavy, soft Angus head to give someone a cuddle.
Last month, Zoe and boyfriend Paul took the 2 dogs with them for the weekend to the Forest of Dean.
And so on the Saturday morning, we set off to do a really long walk. It was fantastically wet and gloomy. Hamish and Angus were running all over the place. And unbeknownst to me, obviously, they'd gone up to the top of the cliff. And I was sort of like wandering along and having an amazing time. I literally just then started to count my blessings. And literally 20 seconds later, a terrible noise.
Both dogs had tumbled down the cliff. Angus had fallen 20 metres and suffered catastrophic injuries. Zoe and Paul eventually managed to get Angus to an emergency vet.
Angus had gone into respiratory distress because of the impact and trauma. He couldn't breathe. And the vet felt that he may need to be put to sleep. I didn't really want to consider that.
Against the odds, Angus's breathing stabilised, but investigations revealed a broken right wrist and severe nerve damage to his left front leg.
At the moment, he can barely move, predominantly because he's just in so much pain. And when you part his fur, he's black and blue. You know, we do have him on painkillers.
The vet has told Zoe if the nerves in Angus's left leg don't recover, the leg will have to be amputated.
Hold on 1 second. Angus is in such a mess, and we're really worried that he's not going to be able to get a viable quality of life.
Would you like to come through?
Zoe and Coco have come to ask Noel what can be done for Angus.
It's all right.
To give him a chance.
Good morning. Oh, what a beautiful dog. Hello. Please come in. My understanding is that there is paresis of the left front leg in the sense that the nerves have been damaged and that the right front leg carpus is busted.
Yeah.
Okay.
Yeah.
So we're just, Mary, if you come this side for me, please. That's it. I just want to double check that there's nothing neurologic with his back legs. When was the accident?
It'll be 4 weeks on Saturday, so it's
Okay. From my initial clinical examination, I can tell you the following. The back legs seem okay, which is good news.
That's great.
The spine seems okay, which is good news. Now, leaving the left front leg to the side for the moment,
Yeah.
the right front leg has a dramatically disrupted carpus,
Okay.
meaning that all 3 levels are disrupted. 1, 2, 3. But I think he's savable.
Okay.
I have had dogs managed quite happily on a wrist fusion, but they bounce. And the downside is there's a lot of pressure in the elbow and the shoulder, so I'm going to need to look at an X-ray picture of the elbow and the shoulder to make sure that they're okay. We're going to do a few checks.
Yes, please.
I'll come and find you soon.
Before he's scanned, Joanna, a neurologist, double checks for any remaining nerve function in Angus's left front leg.
Ready? Musculocutaneous. There's nothing. Something there. You can see he's trying to pull them. Well, we can wait up to 6 weeks, but the way this is going, even if he recovers these parts, he's never going to put any weight back again. It's completely contracted already. This is a losing battle, and it's going to give them more pain trying.
Thanks so much for your time.
Are you okay, Lauren? Yeah.
Thank you, Joe.
Noel also needs to investigate Angus's right shoulder, elbow and wrist.
Better.
It's crucial the joints are strong enough for him to bear weight on one front leg if the wrist is fused.
Okay, Zoe, Coco, come on back in, please. This is the study that we've just done. The wrist is indeed disrupted at all the different levels. There's splinters that have come off this impact because it goes like a nutcracker
Gosh, okay.
and crushes
Ow.
the front of the bone.
Ow, ow, ow.
Exactly. I think he does have some degree of developmental elbow disease, but it's low grade.
So we're still in the
surgery-
ballpark of what's worth doing
Correct,
this.
exactly right. However, what I felt about Angus's left front leg, those muscles are never going to work again. This muscle's never going to work again. This muscle's never going to work again.
Okay.
So the left front leg justifies removal.
He's already tripping up on it, even with it just dangling when he's trying to move around.
Yes, indeed. It's a hindrance to him. And it's controversial whether you take the leg off first and then fuse the wrist second. But my professional opinion is that if the wrist fusion didn't work, why put him through the amputation? Because we'd end up having to put him to sleep.
Okay.
Therefore, I would recommend that we do the wrist fusion first.
Okay, great. As a quick question, you feel that with a successful fusion of the wrist and a well-working back end, that he can have a good life?
To be brutally frank, I think it is a decision between euthanasia and a 3-legged dog with a fused wrist, because we can't leave him as he is.
Oh, crikey, no. Thank you so much for
No
your
worries.
time.
Cheers.
Come on, have a
Thank
get
you.
Angus. Well done.
Come on, handsome.
Noel and his team will design a custom-made implant for Angus's wrist to give the fusion surgery the best chance of success.
You can't go after him. No.
We're very relieved that it looks like we've got a really good chance of not losing him.
He's been hobbling around the kitchen for a month almost now, hasn't he?
Yeah, so I think we were sort of slightly worried that we'd be going home with broken hearts, but which we're definitely not. We've got hopeful hearts. Poor old Angus.
Rocky! Come on. Rocky.
Rocky, a 9-year-old Springer Spaniel, has arrived at Fitzpatrick Referrals with Tanya and Ian.
Rocky, very smart. Very smart. No, stop it.
Despite his enthusiasm for life, he's coping with severe pain after a failed operation on his elbow.
Rocky. So he had an unfortunate incident with another vet. Instead of just going into the bone to stop a little fissure, he managed to put a screw right through the middle of the joint itself. So he's really, really badly limping. Rocky!
Rocky shares his home with Sasha, the couple's other dog. But there's no doubt who's the more energetic of the two.
Oh, good boy! Even though Rocky's getting on a bit, you wouldn't believe it to look at him. I mean, he even climbs trees. You can't help but think of Winnie the Pooh's Tigger. He is a Tigger dog. Good boy.
Irrepressible Rocky arrived in their lives 2 years ago when they found him in a nearby animal shelter.
He'd ended up there, it was a marriage breakup. The two dogs had to be given up, and after about 7 or 8 months, the brother was rehomed and Rocky was left. So we got him, you know, it's like everybody else's loss, you know, it's our gain.
How are you doing?
Since starting his new life, Rocky has become an invaluable part of the family, particularly for Tanya, who has multiple sclerosis.
Rocky's just been so great, because should I be having a bad day, he's there almost like showing you support, you know, yeah, come on, here's my lead, you know, take me out, and, you know, things to do.
But Rocky's enthusiasm for life started to wane when he developed a limp. Investigations revealed a small crack in the humerus bone of his left elbow.
We ended up being referred to a specialist vet who said the best solution would be to put a screw through the bottom of the humerus. But unfortunately, it didn't quite go through the humerus, it ended up going through the joint pocket. Come on.
Rocky is now struggling to walk for more than 20 minutes at a time.
Paw.
And Tanya and Ian are desperate to get him back to his old self.
I feel bad for him, but he's such a brave boy, and so very hopeful that, you know, we'll be able to get him back to feeling good again.
Noel has already performed imaging on Rocky to investigate the damage to his elbow.
So we can see here how Rocky's elbow has collapsed down. The screw is physically sticking into the joint. And we can see this particularly clearly in the arthroscopy where the screw has gouged out the joint surface. The reality here is that Rocky is in significant pain all of the time. There are very limited options to treat this elbow. One option will be to take the leg off completely. The second option would be to fuse the elbow solid. That would, however, leave the elbow without any movement, and therefore Rocky would move in this way, circumducting the limb. Therefore, we are considering a third option, which is total elbow replacement. If we could make that work, it would give Rocky a moving, pain-free elbow.
Rocky is so enthusiastic. Every day for him is a good day.
He's so bouncy. We've opted for a total elbow replacement because we just want to give him every chance to get him back to his pre-op condition. That's it, good boy. Come on.
After 15 months of managing on his painful elbow, Rocky is having his surgery today.
Hello, how are you today? Nice to see you. Right, so today's the day.
Indeed.
Okay, please grab a seat. How you doing? How you doing? So he's been much the same. I can feel a very, very bad crackling in there associated with the progression of osteoarthritis and also the metal rubbing inside the joint. I just want to explain the objectives of the surgery today again. So this is the new implant. So this part is a tray which fits on the radius and ulna. And we use a very special cutting guide system for this implant to go in here. And it's specifically made only for this dog and this implant. Right. Now, there's a shed load of new bone formed around the periphery of the joint. When I get in there, that's going to be like a bag of marbles. So I'll be trying to scoop out much of these bone fragments, but I won't be getting all of them. And the reason I won't be getting all of them is some of them are intrinsically fused onto the bone.
Right.
So if we fail for whatever reason, we have a fusion plate ready here. That's our fallback position intraoperatively.
Right.
And that could happen today. It's a big job, a big, big job. Any questions about this? All set?
Okay.
All right, big cuddles then for Dad. Big cuddles for Mom. Good. Well done. You can go ahead, Johnny. Thank you. Thank you. Good.
Thank you.
God bless. Take care. Cheers, guys. Bye-bye. Bye.
I realised it was going to be complex, but then hopefully, you know, at least the pain he's having at the moment will be taken away.
Double fingers crossed.
Good boy.
Angus, hey, gorgeous boy. I know.
Zoe and son Bertie have returned with Angus, who fell 20 metres off a cliff, irreparably damaging his left front leg and smashing his right wrist.
So we've come back today because Angus is having hopefully the first of 2 operations with Mr. Fitzpatrick. Angus's life really hinges on the success of today. So yes, worst case scenario doesn't really bear thinking about. Good boy, Angus. Steady. Come on, sweetheart. Bertie's coming.
Now then, so what the plan is, we have made a very special plate in the factory over the past week, which is this here, okay?
Oh, wow.
The point of this plate, as you can see, it has special screws in it,
Yeah.
in different positions, and each of those screw holes is threaded. Do you see a little thread in them?
Yep.
And we have special screws that lock in those threads and also lock in the bone. And that fuses the joint. Now, so that's the fusion bit. Now, what I wanted to come on to were the risks. My main worry always with this is swelling impairing blood supply, but I obviously do my best. Infection is also a risk. He must not lick it. Are we clear?
Yes. Yeah.
So give him a big hug now, Bertie. We're going through now.
Yeah. Okay.
Okay.
I'm just going to lift my visors because you won't.
So you go
won't
ahead.
go anywhere.
That's it.
See?
Now.
There we go.
Okay.
Sorry about the visor.
All right. Well done. I'll talk
He's
to you
in the very
tonight,
best time
Bertie.
for you,
Okay.
okay?
I'll see you later.
It's going to be all right, sweetheart.
Okay.
I promise.
Thank
I promise.
you.
I promise.
See you later. Thank you. Okay.
Very worried about Angus. It's been a long time, hasn't it? I haven't got my hanky, I'm afraid. Oh no! Do you want a hug? You sure? Too cool for a hug. If it all goes okay.
Hello. Can I have a back leg, please?
Angus is being prepared for surgery. His left front leg is beyond repair, so everything rests on the success of the fusion of his right wrist.
All right, let's do it. Incision.
An implant has been created using 3D modelling based on Angus's CT scan. First, Noel will remove the cartilage from all of the carpal bones. Then he'll pack in bone graft and position the plate using temporary non-locking screws. Then locking screws are placed in the radius and the carpal and metacarpal bones. The design will allow Angus to distribute his weight gradually through the narrower plates to the thicker plate and up towards the elbow.
There's a lot of swelling here as a result of the explosive trauma.
Noel must carefully move the blood vessels, nerves and tendons to one side, preventing any further damage.
The biggest reason for failure in this operation is that the cartilage isn't properly removed from every surface.
With the cartilage removed, the carpal bones will, over time, fuse together.
Okay, now we're going to pack bone graft into all of the areas from which we've removed the cartilage. This is taking it from Angus's left front leg. I'm going to pop the plate on, have a look. The plate is designed like a kind of chisel, so it goes down underneath the tendons like so. Then we just slide the plate back up into place like so.
Noel uses pins to centre the plate on the metacarpal bones, then uses temporary screws to pull the plate against the bones.
Okay, and now I'm just going to check for alignment. So it should be that the foot is in the normal standing posture, which is slightly externally rotated when Angus is standing, which is what that is, so that's good. We placed a temporary screw here before. We're going to put permanent screws in now. Yeah, I need 2 metric monochrome, please. There you go. All right, let's go to X-ray and let's pray that it's all fine. Well done, Angus. Well done. Okay, great. Thank you, everybody.
The first stage of Angus's treatment is complete. But it will be several days before Noel can be sure that the blood and nerve supply to his foot is intact.
Hello.
Hi, Zoe, it's Noel.
Are you okay?
The operation went fine, yes.
Zoe and the kids will be updated on Angus's progress over the next days. It's one of the most important tasks for the team at Fitzpatrick's.
If I was the mum or dad, the dog at home, I'd be sitting on my couch rocking back and forth. Like, I'd be an absolute nightmare. Like, I'd want to know every detail.
Who's a good boy?
It's equally important to let them know when something good is happening versus when something bad is happening, so they're always kept in the loop and always involved in decision making.
He's comfortable sleeping a lot. People really appreciate the simplest of things. So just saying, yeah, he's eating his dinner tonight can really just comfort people more than I think we tend to realise. Okay, thank you, take care, bye-bye. Rocky.
Oh, doesn't look like a Rocky.
Can you go me, please?
It's early morning and Noel is preparing for one of the most complex surgeries he performs. An independent ethics committee has given the go-ahead for the surgery, so Noel is going to attempt to give Rocky a total elbow replacement.
Okay, good. Hold that. Incision. We cut down on the muscles, elevate them from the bones, and get into the joint. This is all the new bone formation around the joint. Looks like a bag of marbles there. Effectively, it's mineralization of the inflamed tissue, which happens through the disease process of osteoarthritis. We're going to cut off as much of this new bone as we can. As well as that, this new bone formation on the periphery of the bone is actually attached. That's also as a result of inflammation, is called osteophyte.
Noel opens the joint and accesses the screw that's been causing Rocky so much pain.
These are the tram tracks where the screw has been gouging down into the ulna. So the correct position for that screw is straight through the condyle there. Unfortunately, it went into the joint. This will have been excruciatingly painful for Rocky. He is an extraordinary dog to tolerate this pain with such grace. Show me the diagram, please. Johnny, load a 1.8mm drill bit.
Guides that fit to bones gauge exactly where to cut in preparation for the replacement implants.
Show me the diagram again.
But there's a problem.
No matter what way I put that, that doesn't want to sit down.
Further deterioration of the bones means the cutting guides no longer fit exactly.
Yeah, I can't see any way to make both of them fit. And everything depends on this. I wonder, should I just proceed to fusion? Because this is way off.
Noel makes the difficult call to Rocky's family.
Hi Ian, how you doing? So I'm in the middle of the operation now. Unfortunately, the elbow is very collapsed and the tissues around the elbow are very badly affected by osteoarthritis. And I can't get the elbow into a position where I'm comfortable putting in the total elbow replacement that we've designed. So I think in Rocky's best interest, I should abort the mission on the total elbow replacement and fuse the elbow solid with your permission, please. Thank you. Bye-bye. Goggles, please.
With permission to proceed, Noel will now fuse Rocky's elbow.
These are the two components of the plate with an axle between them. And it's designed to be at the standing angle for Rocky.
Noel inserts the implant components, which will immobilize the joint, but hopefully get Rocky out of pain.
The thing about surgery is you've always got to think about what's in the best interest of the patient. And I'm going to go for a second best surgery, which is in between a total elbow replacement and a full limb amputation. I'm going to try and help Rocky as best I can to get him out of pain. So that's the plate construct in position now. That elbow is locked solid. No matter how well you plan a surgery, you always need a plan B. The previous surgery didn't work out, and unfortunately, failure in surgery can happen to anyone. Sorry I couldn't give you an elbow replacement, buddy, but I've done my best with your poorly anatomy.
Good boy.
It's been 10 days since beloved Golden Doodle Angus had an operation to fuse his wrist after falling down a cliff, damaging both front legs.
Don't sit on my biscuits.
Mum Zoe and all 4 children have come to visit him.
I made the best ones, by far.
We've made him some special dog biscuits. They smell. And they do smell. Smell beefy.
Right, gosh, got the entire posse. How are you, everybody? Come on in.
Yeah.
I'm very glad you could come in because I wanted to show you.
And that one's for Angus as well.
Well, you can give this to Angus yourself
Oh, okay.
because Angus is going to be on this rug in a minute.
Oh my gosh.
Now, we have done this big operation on the right front leg, which fused the wrist solid. Now, this is the result. So he's a week out from surgery now, and now that I've got this all stabilized, and as well as that, the swelling after the operation has now come down, and now that that's done, I feel leaving the left leg just dragging is no good for him. It's weighing him down, so we must take it off. So this will be the last time that he will have his left front leg.
Yeah.
Okay.
We just want the best for him, don't we?
I'll bring him in. You can spend as long as you wish. Now, who's here? Now, you okay? Now, take as long as you need, okay? All right?
Hi, Angus. Hello, baby. Goodness me, it's lovely to see you. Thanks very much. Who's got a biscuit for Angus? Like pizza do?
Yeah, that's what I love.
Dear Angus, I love you so much, and in the past few days I've missed you so much. Hamish is missing you too, and it has been a super long week. We made you some biscuits. I can't wait to see you on Sunday. Lots of love, Serafina. Do you want another one? He's an amazing boy.
All right, guys, I'm going to bring him now.
Okay.
And we just got to be brave and do the right thing, don't we? All right.
Amazing, amazing Angus.
Bye, guys.
Oh,
Here we go. See you later, guys.
Thank you.
God bless.
to clip a little. Would you mind to clip a little bit lower down there? Because scapula is here.
The next morning, Angus is being prepared for his amputation surgery.
Right, let's go. I have a syringe and needle.
It takes Noel just over an hour to remove his front left leg.
The final objective of full limb amputation is to prevent infection, and we do that by obliterating all dead space so there's no free fluid, and also making sure that there's a nice skin seal with a small wound. Okay, Angus, good boy.
With both front legs now treated, Angus should be well enough to go home in 48 hours.
Okay, wake up, please. Thanks.
Oh, look. Good boy. You're such a heartbreaker. Come on then, darling.
Well done, mate. Well done. You're such a good boy.
It's been a week since Rocky had the surgery that resulted in Noel fusing his left elbow. Today, Tanya and Ian are taking him home.
Quite excited.
Yes.
It's been a long time since we've seen him, so we're really looking forward to it. All right.
Now! 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 Look at that, look at that, look at that. Exocet missile. Ladies, can you mind him for a moment while I speak to Mum and Dad? Now, so yes, it was disappointing that I had to ring you during the op and say, look, I can't put an elbow replacement in.
Yeah.
It was a mess.
I mean, it's a big screw to begin with, wasn't it? And when it's in the wrong place, it does a lot of damage.
Yeah. So we made that different choice, and this is what that different choice looks like. And that should grow into solid bone over the next 12 weeks. Now, come on outside, Tabs, please. Thank you. Grab that tight, grab that tight. And I will see you in, I'll see you in 5 weeks.
Oh, you know, easy. Yep, that's it. There you go.
It feels brilliant having Rocky back, absolutely fantastic.
Yeah, I mean, we were expecting sort of the worst, that he'd be barely hobbling and just, you know, slowly moving his arm out like a penguin or something, but it was almost as if there was nothing wrong with him.
Our superstar has returned.
Yeah.
Do you guys have a thermometer?
Angus is due to go home today following amputation surgery. But routine checks have revealed his temperature has spiked.
Can I have a scissors, please? We have some really bad news with Angus. All of a sudden, his wound became quite swollen, and then a discharge began from the bottom extent of his amputation wound. And that can only mean one thing, which is infection. So this is special irrigation fluid that breaks down the complex structures that bacteria produce to act together as an army. We're packing swabs into this now to suck out residual infection. All infections like this can be life-threatening. So sadly, it's still possible that we may lose Angus's life.
Noel calls Mum Zoe.
Hi Zoe, Noel here. So we do have problems, I'm afraid. Angus, he has a bad infection. And having done probably hundreds of amputations, I've never seen one like this. It's aggressive, and we won't have the culture result anyway for 4 days or 5 days.
Okay, I don't want the children to see him as he is, but may I come and see him?
Sure.
Is that okay?
Yes.
Right.
Yeah.
Okay.
All right, try and keep the faith, okay.
Thank you, yeah.
Right,
Okay.
God bless. All right, bye-bye. Bye.
Angus will be carefully monitored and kept in the isolation ward.
There have been times, such as with Angus, where we've been in 24/7 with him, making sure that he's okay.
Hey baby, what happened?
I sometimes like get a lump in the back of my throat when I'm with patients that are that gravely ill, imagining what the poor family at home are going through, and you're just hoping that the medication works, because it's either that or they'll have to be euthanized.
How is it going? We have better times.
Angus's wound is now dressed every 6 hours and flushed every day.
Get me an NF kit. Just taking off some dead tissue here. The bacteria has killed. This is called debridement. The hope is that over the next couple of days, with the intravenous antibiotics, Angus will turn the corner. This is still life-threatening at this point.
Zoe arrives on her own to visit Angus.
Thank you. It is cold. I'm very worried that we're asking too much of him. I'm very worried that we'll carry on doing this and then he still won't be okay. And there is still, even if we get over this, there are still so many ifs and buts. If the pancreatic fusion is a success, and if, so at the moment it just feels very frightening and very confusing.
Come on in, Zoe. He's not in here, so don't worry. I just want to brief you beforehand because I know you'll have loads of worries.
Yeah.
Come on in, come on in. So, we now know that the bug is a bug called Enterococcus. And I wonder whether it's because he was on antibiotics for a while beforehand, which suppressed his gut flora and allowed Enterococcus to grow. Fortunately, we got him on the correct intravenous antibiotics.
But it's still producing.
So, yes, last night there was still discharge coming from the hole.
So you think it's still not quite under control?
It's definitely not quite under control. So I once again flushed it and packed it with this special cream. And in conjunction with flushing, which dilutes the number of bacteria, debridement, which takes away their home, and the antibiotic, which kills the bacterium itself, one would hope that that does the job. I think if we can get him through the next 10 days, his long-term prognosis will be good. I'll bring him in. Come on, mate. There we go. Now, Mama's here.
Hi.
Now, listen, you take your time.
Okay.
We'll be back. Okay.
Oh, sweetheart. Oh, Angus. Calm down, calm down. Come on, settle down. I know, my darling. I know. Angus, 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 I know. Shh, 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 shh. I'm not going anywhere. Angus. Oh, darling. Shh, shh. Angus, shush, shush, shush. Shush. Shh. Angus, shush. Shh. Shh. Angus. Shh. Shh. Your leg looks amazing. It looks amazing. You are amazing. I'm so sorry. I'm so sorry this has happened to you. Poor Bertie burst into tears in school. He did. Didn't know what to do without you. I'm sorry, you must have been so frightened. Thank you so much for trying so hard for us. Thank you. Thank you, thank you. Good boy.
Angus, the golden doodle who fell off a cliff, is fighting an infection that took hold after his left front leg was amputated. Zoe asked Noel to continue treatment, and at last there are signs of improvement.
So the tissue looks a lot better now. It's a lot less oozy.
Today, Noel is hoping to insert a drain which will draw out any remaining fluid, helping the wound to heal.
So the big sharp needle comes through the skin, and we pull it all the way through. Can I have, please, 3 metric PDS NF needle?
Finally, Noel is able to close the wound.
Okay, good, last stitch.
If the drain works, Noel will be able to remove the tube in a few days' time in the hope that Angus will finally be clear of the infection.
Okay, Angus, good boy. Thank you.
Rocky, come on.
It's been 6 weeks since spirited spaniel Rocky had surgery to fuse his elbow.
Hey.
Today, Tanya and Ian have returned to discuss how Rocky is adjusting.
Are we ready? Hello. How are we getting on?
His nose is certainly working.
Looks like we're raring to go.
We are. He's so keen to he's obviously not in anywhere near as much pain or any pain at all. Yeah. He's still, I think he realises his leg is weak.
Yes.
So as soon as he's in a hurry to get anywhere, it's shoulder blade up.
Yes.
And leg just moved out of the way.
Well, he's just getting used to having a fused elbow. Let's take him through for x-ray. We'll have a look and then I'll have you back in. Come on, big fella. Good. Good, well done, good. I'll come and find you soon.
X-ray pictures will reveal how well the elbow bones are fusing together.
Hi guys, come on in.
Thank you.
There we go, everything's going fine.
Brilliant.
So I'm very pleased with how the healing is going.
Excellent.
The implant's working beautifully well as designed. It's all now about rehab.
Right.
That is a combination of range of motion exercises plus hydrotherapy. Yeah. I will bring him through.
Brilliant, thank you.
If all else is equal, in 6 weeks from now he can run around happily. Good.
Thank you.
God bless. Take care. Cheers, guys. Bye-bye. Bye. Look after yourself.
You too.
You too.
Thank you.
Thank you.
There you go, boy. Oh yeah, he's definitely a happier dog. He's doing more of his little smiling. He might not be smiling just at that moment because he's a bit dopey. But
I suppose it's up to us now to take him to his hydrotherapy and physiotherapy sessions so we can all practice together.
When Angus the Golden Doodle arrived at Fitzpatrick's, he had barely survived a 20-metre fall. Despite Noel managing to save his right front leg, a life-threatening infection took hold after his left front leg was amputated.
You're right.
I think I just missed him.
This bone?
Missed him.
Yeah, it's been a long old journey.
Oh.
Now!
But after 3 weeks of intensive treatment, Angus is finally ready to go home.
I've already seen him. You guys say hi.
Yay!
Oh, wow.
Hello, everybody. Hello, I'm so happy to see you all.
Come on, Hanson.
Angus, come on.
Do you not want to go home now?
Hi.
Well done, you. You're such an amazing man. Really, the most extraordinary thing is just tell him he's just taking it all in his three-legged stride. I mean, really, he's being incredible, isn't he? And thank goodness, because actually I was wavering, and it was my team of 4 who said, no, Mummy, please, please keep going. So we did. And look, it was all worth it, wasn't it? Amazing, amazing boy.
good boy. Rocky.
It's been 12 weeks since Rocky had his elbow fused, and to help him with his mobility, Noel has recommended hydrotherapy.
Rocky's been doing laps of the pool, and he's also had goes on the underwater treadmill.
Good boy, go on, you can do it.
Apparently egged on by the reward of cheese from a tube.
Boy, that's better.
Despite making progress, though, Rocky is now facing another hurdle. He's been diagnosed with cancer and has had further surgery to remove a tumour from his abdomen.
Rocky, come on.
Ever the fighter, Rocky is once again off the ropes.
Go for it. Currently he's tumour-free, and we're hoping he stays that way. And because he's now able to do his hydrotherapy and physiotherapy, he seems to be making great steps forward. Good boy, Rocky, good boy.
It's so good to see him back to his old self and his usual enthusiastic ways.
Now that Rocky's pain-free, I just think he's going to be enjoying life to the full, chasing pheasants, partridges.
Rocky loves life so much and just couldn't be more grateful. What a superstar, what a good boy.
In Northamptonshire,
Come on, boy. Angus, Hamish.
a three-legged Angus is getting back to life in the big outdoors.
Having Angus back is completely extraordinary. He's just slowly building his fitness and his physiology is changing to cope with it. His back end is getting much stronger.
Having survived a 20-metre fall and a life-threatening infection, Zoe is in no doubt that Angus is a very special dog.
If I think back now to sort of a few weeks we had him literally dragging himself around. It's so extraordinary, the difference. It's amazing, it's wonderful. Steady, Angus, Hamish! I'm just deeply grateful that we stuck with it and that he's still here. And I think we've learned a lot of lessons from him and from life.